Hey girls! Let's talk about something really important today, your heart. I brought an interesting paper. The title is Disparities Among Black and White Patients in Plaque Burden and Composition and Long-Term Impact. Sounds difficult? Don't worry. Uni will break it down step by step. Firstly, the introduction section. Did you know heart disease is the #1 cause of death for women? For Black women, the risks are even higher. But it's not always about diet or exercise. A new study looked inside the heart's arteries using advanced imaging. And what they found might change the way we think about heart health. Methodology. So how did they do this? Researchers looked at over 1,300 patients getting heart checkups. They used a mini camera and infrared light to scan the inside of the arteries. This shows how much plaque, or fatty buildup, is hidden inside. They focused on arteries that seemed fine, not the ones with full blockages. Then they followed these patients for 2 years. They wanted to see who had serious heart issues later on. Here's what they found as their result. First, health conditions and risk factors. Black patients were more likely to have diabetes, high blood pressure, prior stroke, heart failure, and kidney problems. White patients had more history of prior PCI, a heart procedure, and underwent PCI more often during the study. Second, Black patients showed more severe symptoms, like non-ST elevation heart attacks. White patients were more likely to have stable angina or silent ischemia. White patients were also more often prescribed aspirin and statins compared to Black patients. Third, plaque characteristics. Scans showed larger vessels and more plaque burden in Black patients, even though their arteries didn't look worse at first. A dangerous plaque feature, MAX CBI 4 mm 400 was much more common in Black patients, 46.7% versus 30.6% in whites. Fourth, outcomes 2-year follow-up. Black patients had a much higher rate of major adverse cardiac events, MACE, 15.1% in Black patients, 6.7% in white patients. Even after adjusting for race and other risk factors, having a high-risk plaque strongly predicted poor outcomes. Discussion. Black patients in the study had more risk factors like hypertension, more lipid-rich plaques, and higher rates of heart events than white patients. Even after adjusting for other risks, Black race itself and plaque type remained strong predictors of heart problems. Even after adjusting for other risks, Black race itself and plaque type remained strong predictors of heart problems. Previous studies also show Black patients have larger vessels, more plaque buildup, and higher secondary event rates. Overall, racial disparities in plaque composition and outcomes are consistent across many datasets. So, what's the conclusion of this paper? Compared to white patients, Black patients had more lipid content, bigger plaque burden, and more heart events over 2 years. Black race, combined with high-risk plaque features, may act as a marker for higher coronary risk. Today, Uni breaks down a research paper on why heart disease symptoms can look different between Black people and white people, and what might be behind those differences. Pretty eye-opening, right? Next time, I'll bring you another fascinating study, so stay tuned.